There is a clear association between obesity and increased risk of breast cancer.
That's one.
Yeah, that's better.
Yeah, they're doing.
That's good. As we just listened from the previous presentation, obesity may also negatively affect prognosis after breast cancer. Given the increasing prevalence of obesity worldwide, we may expect a rising number of breast cancer patients, so the challenging of management of these patients becomes more and more important. So our study population were all women diagnosed in Geneva between 2003-2005, for which we had information on weight and height. And we compared obese women with a BMI equal or greater than 30 with normal low-weight women with a BMI less than 25. We didn't consider the women in between just to make the comparison more extreme. Our comparison included a lot of variables, diagnostic variables, tumor characteristics, and treatment. For tumor characteristics, we didn't find any difference between obese and not obese women in terms of histology or grade, but obese women were more likely to be diagnosed with an advanced stage, a stage 3 or 4. For palpability of the tumor, the obese and not obese women were actually equal, but then when looking at non-palpable tumors, obese women have a higher risk to be diagnosed with a tumor which was bigger than 1 centimeter. And for lymph node palpability, axillary lymph node palpability was also, there were not differences between the two BMI groups, but then again, among non-palpable women with not yet palpable lymph nodes, obese women were at higher risk to have an N2 entry lymph node classification. Also, after we found that obese women were at high risk to have a delay of more than 4 weeks between diagnosis and surgical treatment as compared to lean women, and also that they were more likely to stay in the hospital after surgery for more than 5 days as compared to lean women. In particular, we had 67% obese women who had a longer than 5 days stay at the hospital as compared to 47% among lean women. So we see that obese women face several disadvantages compared to not obese women, and what we need is to seek to find more appropriate strategies for surveillance, detection, and treatment to optimize the diagnosis and care of these patients. Thank you.
Okay, thank you. Or reduce the incidence of obesity.
That's right, yeah, absolutely. Yeah.
Maybe it's a small solution. I'm not completely sure.
Well, but for those that are
okay, but that's a cultural problem, of course, and that we can't solve here in this table.